assessment of concordance between Yale Open Data Access brackets, Yoda close brackets. Are you all Star Wars fans at Yale?
Blame Joe.
Okay. Project data requests and corresponding publications. Over to you, Josh.
Great. Well, I'm Josh Wallach. Thank you for the introduction. I'm faculty at Emory University. Very happy to be here. I want to thank the Peer Review Congress for the opportunity to present this work on behalf of our team. So let's see, other people have been perfect. So this is going. We couldn't fit this on the first slide. I'm sorry. We have some competing interests. Some of our collaborators are the providers of the data from the Yale Open Access Project. We have our funding sources listed here, happy to discuss, and it's all available online. So I think a lot of this has already been talked about today and other days, but I'll give a brief background recap about why we're interested in the data sharing and the concordance between protocols and final publications. So over time, the support for data sharing has increased, as both Daniel and Anna talked about. There are many reasons for this, including secondary analyses, reproducibility and transparency checks, meta-analyses using individual patient-level data. And the different approaches over the past few decades have been developed to ensure that individual patient-level data can be shared in a way that's scientifically sound, that protects the participants, that allows for secondary analyses that are scientific, that are not used for any predatory purposes. And some of these methodologies have been around for a long time. The BioLink through the NIH and the Yale Open Data Access, if you want to read more about the approach that's used, there are a few papers that talk about the method of data sharing that's used. And I think this is going to be more and more important as the NIH policy on data sharing goes into effect in the beginning of 2023. So as we have to start thinking about, for all federal grants, data sharing statements and data sharing plans and ways to make data openly available. So as I mentioned before, there are many different platforms that support responsible data sharing. And I say responsible because when we're talking about individual patient level data where there are some risks involved, we want to make sure that it's in a protected environment, that researchers have access to this data, and they are doing analyses that are planned. And I've listed a few here: Vivli, Clinical Study Data Request, which is run by GSK and a few other pharmaceutical companies, BioLink from the National Institutes of Health, and the Yale Open Data Access Project, where I am an affiliate. I am not one of the founders, so if there are questions about the background of Yoda, I think you could also talk to Joe Ross, who's here. So this started in 2014, and it was, there's a partnership between the Yale Open Data Access Project and the pharmaceutical company Johnson & Johnson. And through the Yale Open Data Access Project, individual patient level data from clinical trials on the products that Johnson & Johnson studies and develops can be requested by investigators who want to do secondary analyses, meta-research studies using individual patient-level data, systematic reviews, meta-analyses, et cetera. You can propose a project, give details, your affiliations, your funders, your primary endpoints, your plans, a plan to publish, and I should note that this is completely free. So this is maybe an informal pitch and an invitation that this is a nice resource for the meta-researchers out there to use clinical trial data for their analyses and their studies. But it also provides an interesting opportunity to think about how publications, because the Yoda project requires a dissemination plan. So for every proposal that's submitted for an analysis using individual patient level data from Johnson & Johnson, a proposal and publication is available. So we can start thinking about some of these questions that have been talked about for primary randomized controlled trials or trials. So these issues of outcome switching or selective outcome reporting. And we know from the literature, and as many of others have said here as well, selective outcome reporting has been prevalent in the reports of the first publications of trials in systematic reviews and meta-analyses. And there are a large number of great studies in this area, and I suggest looking at these and others. And some evidence suggests that up to 60% of trials have at least one outcome, whether this is a primary outcome or a secondary outcome, that changes from the development stage that's outlined in a protocol and the final publication. So there's some switching that's happening. But we don't know as much about secondary analyses. So our evidence is really on the primary publications of randomized controlled trials. And this is obviously concerning. But I think it's interesting to think about in the observational space where we're reusing data and we're actually trying to do secondary analyses of shared data. What's the consistency between what's planned and what's actually done? So we thought we would use the YODA data sharing platform to study this. So to evaluate the concordance, so the agreement between what's actually planned in terms of which studies are requested by investigators, what the study objectives are, what the endpoints are, and what methods are actually proposed. And we focused on the YODA project clinical trial data and their corresponding publications, which are all openly available and listed on the YODA website. So in order to conduct this study, we identified all requests for Johnson & Johnson data through the YODA platform, and we identified those with at least one publication. So some projects are still ongoing and they may not have disseminated their research yet. And for each of these, we looked at the full proposals and the full publications and mapped out what their primary objectives were, which trials were requested, and what the primary and secondary endpoints were and the statistical methods. And for each of these, we looked at concordance in different ways. So for primary objectives, we were what I believe as fair as possible, where we classified things as fully concordant if the exact same study objectives were outlined in the proposal and in the final publication. Partially, we're giving some credit that big picture, they're trying to do the same thing. And maybe in reality, stuff has to change when we actually know how the data works and we actually get our hands on the data. And fully discordant. For a number of trials requested, this was a numerical concordance. For primary and secondary endpoints, we classified these as concordant, partially concordant if there were additional endpoints, or discordant if endpoints were dropped or swapped. Statistical methods is another challenging one for all of you who have used shared data. Things do change as you learn the language of the data. So we looked for the broad methodological approaches were consistent. Of course, some of the details do change between protocol and publication, but we wanted to see whether or not they're really trying to do the same thing. So what did we find? So we had 48 at the time. I think we're happy to report that there are more publications that are now available for data requests. And we looked at the primary objectives and found that 69 of the 48 protocol publication pairs had fully concordant primary objectives. 27% had partially concordant, so we could consider these as looking at the similar questions, but that there were some additions that may not have been outlined in the proposal. And 4%, only 4% were fully discordant, where there's actually completely different questions that are being evaluated in the final publication and the protocol outlining the objectives. Now, just to give a quick example, and we will have more of these as we develop the full paper, the request was to determine the optimal dose of immunomodulators when in combination biologics. So that was what was outlined in the proposal. And in the publication, we found that it was not exactly the same objective. They were looking at response rate for a certain therapy for patients with IBD. So again, we're seeing here that, this is very challenging to do in a full paper that doesn't always clearly outline the objectives, but we're seeing that these are not actually consistent in terms of the questions that they're asking. So number of trials requested and analyzed, and this was an interesting one. Again, among the 48 total, we found that 58% were concordant. So the number of trials requested to analyze were the same in the publication. So they used all of the trials they actually wanted to in their request. We found that 42% among the discordant were for a greater number of studies listed in the request, so that they're actually requesting more studies and then not including them in the analyses and publication. And there were a number where it was actually impossible to determine how many studies were included in the publication. So this could be a systematic review and meta-analysis where there was not any detailed information outlining which of the requested studies were actually eventually included in the analyses themselves. In terms of primary endpoints, and I think, some of this I think is reasonable changes. So again, we classify them as fully, partially, and discordant. 65% had fully concordant primary endpoints. What was outlined in the proposal, those were the primary endpoints that were in the publication. 15% were partially concordant and 21% were discordant. And to give an example again, the data request outlined in one of these data requests that we studied that overall survival and progression-free survival were the primary endpoints, so co-primary endpoints. And in the publication, only overall survival was the primary endpoint and progression-free survival was a secondary endpoint. Which, again, maybe there were difficulties analyzing, maybe there was outcome switching. It's hard to tell, but this is something that we thought is important to think about. For partially concordant, here there's examples of additional primary endpoints that were added or additional endpoints in the publication. For statistical methods, 81% had broadly the same statistical methods in the approach and in the publication, and 19% were fully discordant, where what was outlined did not mirror what the intention was. So I think here's a decently interesting example where the request outlined fairly simple descriptive statistics, paired t-tests, et cetera, and the publication outlined in a large number of a fairly large and robust section, the mixed effect models that were used. So what does this all mean? I think we have some takeaways here that are interesting. So investigators should explain deviations from data requests in their publications, and I marked this one as realistic. We looked at this in the publications and we found that this almost never happened. We could not determine why these changes were made, why studies were not included, why outcomes were swapped, why statistical methods were changed. And I think this is a realistic thing because we're asking the authors to take the initiative. Potentially challenging is the burden on reviewers or editors. Should they compare the consistency between the data request and the publications when these are submitted for publication in journals? And I think this is a challenging one. We've talked about the stress and the pressure on peer reviewers, and the same goes for editors who have endless number of items on their plates as well. And then there's also the responsibility of the data sharing platforms like Yoda. So they should require authors to disclose changes. And based upon the findings of the study, this is actually something that's in discussion and ongoing, is figuring out a way to have a template that outlines the changes that authors make from their initial plan to the publication and disclosing why these changes were necessary. And again, some of these changes may be important and may be realistic. Some of these changes may not be as important and realistic and are necessary to disclose. So at least they're available on the Yoda website if they're not disclosed in the publication themselves. See, I should have pressed the button first before the main takeaway. So overall, and this is, I think, very pessimistic, but not super surprising, no requests were fully concordant with the corresponding publications across all of the domains. But this was most likely because fewer trials were used than requested, so that a larger number of trials were requested, and when it came to actually analyzing the data, they were not all included. This is challenging because you don't always know what can be used until you actually see the data. So I think this might not be as negative as 0 out of 48 scenes. I didn't have limitations on the slide, but of course there are limitations. We reviewed this manually. We did not correspond with the authors to figure these things out. But I think this is important for us to be able to identify reasons for changes and changes using publicly available information without correspondence. I'd like to thank the Peer Review Congress, of course, for hosting this and for allowing all of us to come together. This would not be possible without a fantastic team. One of them, Enrique Vasquez, who's not here today, was a Yale College student who's worked a lot with us on data sharing and transparency in clinical trial platforms, as well as the other Yale students who are here today. I'm looking forward to questions and discussions. Feel free to contact me, and thank you.
Okay, over to you.
Thanks. Quick question. Thank you very much for your presentation. So I'm curious, people will ask for more trials than they will possibly use. thinking that, I might as well ask for everything and then see what you get. But I would imagine that in writing up a report, you exclude them and you include them in some diagram that you've excluded them. Was that considered, or they don't even mention what they excluded?
So that's a great question. Thank you. And it is true. If you're considering a question where trials may be eligible and you've looked at the metadata that's available on the YODA platform that describes it, and you think there's a reasonable chance it's possible, it makes sense to request it. We found one example of a study that explained why one of the studies they requested was not included. There are other examples where 5 studies were requested and the publication itself turned out to be a secondary analysis of one publication. So we're not seeing a lot of this disclosure in terms of what's happening. And I think this is an easy ask of authors and an easy implementation on the YODA side in terms of requiring authors to disclose this. It's a great question.
Thank you. Question at the back.
Good morning, Dr. Wallach. Thank you for your great presentation. In 2016, our group from the University of Split School of Medicine, my name is Shelley Brownage, we did similar research where we assessed the changes between clinicaltrials.gov and corresponding publications. And we also looked at those changes. Those changes are extremely important to assess as well. I wondered in your research, did embargoes, stipulated embargoes from Johnson & Johnson affect the number of publications you were able to find, or has YODA managed to sort of work out with Johnson & Johnson to kind of alleviate those embargoes so that the public can have more access to, that the data is more accessible, that's what I mean, or something where you're able to have links to publications freely?
Yeah, so I thank you for your question, and I know you work in this space as well, so I appreciate you talking about that. So YODA acts as like an intermediate between Johnson & Johnson and the data request. So every request that comes to Johnson & Johnson is reviewed independently from Johnson & Johnson, and decisions to share data based upon those requests are made independent of Johnson & Johnson. So publications, once they're finalized, they are provided to YODA, but there isn't a screening by Johnson & Johnson of the publication to ensure anything. That's not something that happens. So these publications are shared with the YODA platform, and they're published, and they're available on the YODA platform, and they're available in the journals that publish them.
Okay, thank you.
Thank you.
Thank you. Question at the front. Yeah.
All right. So Kyung-won Hong from University of Maryland. Thank you for fascinating talk, fascinating topic. I'm just curious, this may be a bit beyond of your scope, but did you try to compare the data request versus trial registration or study protocols? I'm asking this because in terms of timeline, I guess it is like in the beginning of the conduct of trial, it's like kind of matches. So I just wanted to see whether it really matches or concordant.
So if I think I'm understanding correctly, that you're talking about the original trial registrations on like clinicaltrials.gov.
Exactly.
So these are all completed trials that have been processed, where the data can be requested and is openly requested. These requests for secondary analyses have nothing to do with the original trials. These are separate from the initial clinicaltrials.gov registration. So we did not look at anything in relation to that because we had the trials and we had the information on the data request. We did not need to know what the initial outcomes were in the trial. What we really cared about is what the authors wanted to do and what was eventually done in the publication.
Thanks for the clarification.
Great, thank you.
Thank you. We've got a question live. I'm going to take you at the front, and because you've been waiting patiently. Over to you.
Thank you. Veronique Kiermer, PLOS. Thank you very much, Josh. That was a really important study, I think. I was curious, it may not be as relevant to YODA because it's J&J data, but did you look at how the data was, how the original trials were credited in the secondary publications? I mean, we've heard, one of the barriers to sharing is academic credit for reuse. Did you look into that?
No, we did not, but I think this is interesting. And I should note one item, you set this up, is that we've done this now for Johnson & Johnson's data through YODA because this is a convenience sample.
Right.
But we have the data for many other platforms that are sharing, and we're going to be looking at this as well for clinical study data requests, Vivly, and so this is work in progress. So that's our plan as well, is to think about these other platforms and not to compare them, but to try to understand what can be done to improve the reporting of concordance.
Thank you.
Thank you.
Thank you. And online question.
Yes, from online, Melissa Ruthlifson from the University of New Mexico says, wonderful presentation, fascinating research. It is particularly concerning in light of clinical data sets that might include tribally sovereign data from indigenous populations with special conditions for sharing. What do you recommend for the use of this type of data and preventing misuse of data with particular data sharing conditions?
That's a great question. I appreciate that you were able to include this one. I think many of these platforms demonstrate the protection that's provided through controlled sharing of data. So I mentioned this briefly, and it's in a 10-minute talk. I could go into a 10-minute talk at least about what happens to share the data, but everything is de-identified and in a controlled environment. So the data requesters do not get access to the data on their computer. They do not receive these files. They do this through a controlled environment, and they have to have a research purpose, and they have to outline a research purpose. So what this prevents is snooping in data, attempts to re-identify. While I cannot say with certainty that this will never happen, we have not seen this happen with shared IPD. So I think this framework of controlled open access allows for some protection, especially when we're dealing with confidential and important information, such as what was included in the question.
Thank you.
Great, thanks.
Great. Josh, thank you very much.
Thank you.